Whenever we hear the word muscle or the phrase muscular system, it's not uncommon to instantly think of someone flexing their biceps or a thought of a strong man with big, strong muscles. To some people, the muscular system's only function is for lifting heavy things, but there's so much more to it. Today, our group will be discussing the muscle system, its multiple parts, and its specific functions. What is the muscular system? The muscular system consists of all the muscles of the body. Its function is to produce movements like walking and running, stabilizing body positions such as our body posture, storing and moving substances within the body, like how the heart pumps blood for our body, and generating heat, such as when we feel cold, we shiver. The muscle system does not do all the work in producing these movements. The muscular system works together with the skeletal system. The muscles are attached to bones by tendons at their origins and insertions. Skeletal muscles produce movements by pulling on bones. Think of it like the muscle acts like a rubber band that moves the bones in order to produce movement. In the muscular system, we can find muscle fibers, which are long and narrow and relaxed. These muscle fibers are also specialized contractile cells, meaning they are able to produce contractions. They are all organized into tissues that move body parts or temporarily alter the shape of internal organs. The muscles in the muscular system are described based on their distinct characteristics relating to whether it's voluntary or involuntary, meaning if we need to be conscious when producing the movement, whether it appears striped or unstriped. This pertains to how it looks when viewed under a microscope, whether it is striated or smooth. Next is whether it is located in the body wall and limbs, or make up hollow organs of cavities or blood vessels. Now, based on those previously discussed distinctions, come the three types of muscle in our body. The first is skeletal muscle, which are striated, voluntary, and is composed of one specific type of muscle tissue. So as you can see in the image, the skeletal cells are striated because of the long, thin, and parallel streaks. Voluntary, meaning we need the conscious thought in order to produce its movements. The second type is the cardiac muscle, which are striated and found only in the heart, hence it being called cardiac muscle. It is involuntary because we don't need the conscious thought in order to keep our heart beating. The third type is the smooth muscle, which are smooth because you do not see long, thin, and parallel streaks, and it is located in the hollow internal structures. They are also attached to hair follicles, and they are involuntary. These smooth muscles can be found along our gastrointestinal tract, and they help push around food through it. Going a little more into the specifics, we're now going to tackle as to how muscles are named, which is through their form, feature, or location. Our examples in this presentation are the levator scapulae, which is named because of its function, which is to elevate the scapula. Levator in the name means to elevate. We also have the sternocleidomastoid muscle, which is named because of its location, which is attached inferiorly to the sternum and clavicle, and superiorly to the mastoid process of the temporal bone of the cranium of the body. For our last example, we have the transverse abdominis. It's named so because of its location, which is located transversely or around our abdomen. Now we can proceed to muscle coordination. Whenever we produce a motion like, for example, flexing our biceps, there are four main coordinators. The prime mover or the agonist, which is responsible for the action. The antagonist, which yields to the effect of the agonist. The synergist, which complete prime mover's move. And the fixator, which stabilizes the origin of the agonist in order for the agonist to function more efficiently. In the action of doing a bicep curl in a workout, the prime mover would be the biceps brachii, which is responsible for flexion, the synergist being the brachialis, which help the agonist in flexion, the antagonist, which is the triceps brachii, that is located on the opposite side of the arm, and the fixator being the muscle that holds the origin of the agonist, like the rhomboideus.
Muscles of the head. The muscles of the head are the muscles of facial expression, which provides us with the ability to express a wide variety of emotions. Facial muscles are responsible for two major tasks: for chewing, for making facial expressions such as smiling, pouting, or raising your eyebrows. So there are five facial muscles involved in chewing: the buccinator, the lateral pterygoid, the masseter, the medial pterygoid, and the temporalis. So what does the buccinator muscle do? The buccinator muscle is involved in many of the mouth's functions. It includes those to do with chewing, swallowing, sucking, blowing, and speech. The most important buccinator muscle function is to keep the cheeks near the teeth, which helps with the chewing. The buccinator muscle is loosened and tightened when the mouth opens and closes, and it helps direct food toward the tongue. And because the buccinator muscle keeps the cheek near the teeth, it also prevents accidental biting of the cheek lining. The buccinator muscle has another function in the mastication process as well. In this regard, it assists with saliva secretion by dilating the duct of the parotid glands, or also known as salivary glands. The buccinator also helps the mouth open wide enough to form a certain sound such as the I and E, sounds that require the action of the mouth opening a bit wider. Since the buccinator muscle determines how much open space exists inside the mouth, it is also integral to tone and echo. And lastly, the buccinator muscle is also necessary for smiling. So the second muscle is the lateral pterygoid muscle. So the lateral pterygoid muscle is a craniomandibular muscle that plays a crucial role in the inferior temporal region. It is active during mastication and mandibular movements, including protrusion or forward movement of the mandible, abduction, the depression of the mandible, the mediotrusion, the mandibular condyle movement towards the midline. And it also works particularly during speaking, singing, and clenching. So the next muscle is the masseter muscle. It is one of the four muscles responsible for the action of mastication. When the masseter contracts, it causes powerful elevation of the mandible, causing the mouth to close. Its insertion along the angle and lateral surface of the ramus also allows it to aid the protrusion of the mandible, allowing for the anterior motion of the jaw. So the next muscle is the medial pterygoid muscle. So the medial pterygoid muscle works with the other three muscles of mastication to produce several different types of movement. When working with the masseter and the temporalis muscles, the medial pterygoid helps to raise or elevate the lower jaw. With the lateral pterygoid muscle, the medial pterygoid enables the lower jaw to produce or move forward. This movement is known as protrusion. In conjunction with the lateral pterygoid, the medial pterygoid muscle also produces side-to-side movements of the lower jaw. And along with the masseter, the medial pterygoid forms a muscular sling in which the lower jaw is suspended. Scientists call this the pterygomasseteric sling. The forward and side-to-side movements of the mandible produced by the medial pterygoid, in conjunction with the other three muscles of mastication, represents actions that are essential to chewing in humans. When examining the two types of pterygoid muscles, The medial pterygoid muscle is larger and capable of generating 1.6 times more force than the adjacent lateral pterygoid muscle. Though not as strong as the masseter, the medial pterygoid still plays an important role in developing of TMJ, or the temporomandibular joints. The last muscle for chewing is the temporalis muscle. So the temporalis muscle is primarily responsible for facilitating the act of mastication. This muscle inserted into the coronoid process and ramus of the mandible helps the lower jaw to move up, backward, and side to side at the temporomandibular joint. These movements collectively help in biting and chewing food in the mouth. So those are the muscles for chewing. So let's move on to the muscles of facial expression. So the first muscle of facial expression is the auricular muscles. So the auricular muscles are extrinsic and intrinsic muscle of the auricula, which connect it with the skull and scalp and move the auricula as a whole. Next is the corrugator supercilii. The corrugator supercilii is a paired muscle found deep to the medial end of each eyebrow. Upon contraction, this muscle draw the two eyebrows together medially and inferiorly, thereby producing vertical wrinkles over the glabella and an expression of frowning. So the next muscle is the depressor anguli oris. So the depressor anguli oris pulls the angle of the mouth inferolaterally. Its action plays an important part in facial expression as it helps expressing feelings of sadness and anger. Next, we have the depressor labii inferioris. So the depressor labii inferioris is a facial muscle that helps lower the bottom lip. This muscle arises from the oblique line of the mandible and inserts on the skin of the lower lip, blending in with the orbicularis oris muscle. Next, we have the levator labii superioris aliquae nasi muscle. So the levator labii superioris muscle, also known as the quadratus labii, contributes to facial expression and movement of the mouth and upper lip. It courses alongside the lateral aspect of the nose, and its primary function is elevation of the upper lip. Next, we have the mentalis muscle. So the mentalis muscle elevates the base of the lower lip, thus averting and protruding it. This movement also wrinkles the skin of the chin. The function of this movement is to adjust the shape of the lips for drinking, as well as the express facial expressions associated with emotions of sorrow, contempt, and doubt. Next, we have the nasalis. So the nasalis is also known as the compressor naris. The nasalis muscle is located within the nose. It works like a sphincter or ring-like muscle. The muscle works as its alternative name suggests to compress nasal cartilage. Also, it depresses the lip of the nose while it elevates the nostrils corner. Next is the occipitofrontalis muscle. So the occipitofrontalis muscle is a muscle which covers part of the skull. It consists of two parts or bellies, the occipital belly near the occipital bone and the frontal belly near the frontal bone. It is supplied by the supraorbital artery, the supratrochlear artery, and the occipital artery. Next, we have the orbicularis oculi. So the orbicularis oculi is a muscle located in the eyelids. It is a sphincter muscle arranged in concentric bands around the upper and lower eyelids. The main function of the orbicularis oculi muscle is to close the eyelids. This occurs when the muscle contracts. The next muscle is the orbicularis oris. So the orbicularis oris is a complex circular muscle that surrounds the orifice of the mouth and forms a majority of the lips. It belongs to the large group of muscle of facial expression called the buccolabial group. This is the procerus. The procerus muscle is a pyramidal shaped muscle arising from the fascia of the superior nasal region near the junction of the nasal bones and the superlateral nasal cartilage. The procerus muscle fibers run superiorly and merge with the frontalis muscle. Muscle fibers insert into the skin between the eyebrows. So the procerus muscle depresses the medial end of eyebrow and wrinkles the glabellar skin. The next muscle is the risorius muscle. So the risorius muscle is a narrow bundle of muscle fibers that becomes narrower from its origin at the fascia of the lateral cheek, over the parotid gland and superficial masseter and platysma muscles, to its insertion into the skin of the angle of the mouth. Lastly, we have the zygomaticus major and minor. So the zygomaticus major contracts, it pulls the angle of the mouth superolaterally in synergy with the risorius. Zygomaticus major produce the expression of smiling. This function is followed by the deepening of the nasolabial groove. And the last one, the zygomaticus minor muscles. So in the area of their respective action, the zygomaticus minor elevates the upper lip, thus exposing the maxillary teeth. The function of this movement is to facilitate speech, as well as to enable various facial expressions such as smiling. So let's move on to the muscles of the neck. The neck muscles are part of complex musculoskeletal system that connect the base of your skull to your torso. The muscle is the in your neck are skeletal muscles, meaning they're attached to bones by tendons. They're voluntary muscle. So the neck muscles serve a variety of functions, including elevating your upper ribs so you can inhale, helping with chewing, swallowing, and speaking, making certain facial expressions, moving your head, neck, and upper back, including your shoulder blades, and stabilizing and supporting your head, neck, and spine. We have the anterior neck muscles include like the platysma, sternocleidomastoid, the subclavius, suprahyoids, the infrahyoids, and the scaleness. And we have also the posterior neck muscles include the splenius capitis and the splenius cervicis, the suboccipital muscles, the transversus spinalis muscles, and also the lateral neck muscles include the rectus capitis anterior and rectus capitis lateralis, the longus capitis, and the longus colli.
So what is the muscle of thorax? The thoracic wall surrounds the thoracic cavity, which is the anatomical region where viscera like the heart and the lungs can be found. The thoracic wall contains a variety of muscles, where many of the muscles that cover and attach to the thoracic wall have a primary action elsewhere, such as the arms, neck, and the abdomen, and it is their secondary action that affects the movements of the thoracic wall. Like for an example, the pectorally major and the pectorally minor muscles overlay the thoracic wall, but they are primarily involved with movements of the upper limb, and their secondary action is to act to the thoracic wall as an accessory of muscles in respiration.
The anterior and the posterior thorax. The anterior thorax. The anterior have four muscles: the pectoralis major muscle, the pectoralis minor muscle, the serratus anterior muscle, and the external intercostal muscle. The pectoralis major muscle is the largest muscle of the anterior chest wall. The function of this chest muscle is the adduction and the internal rotation of the arm on the shoulder joint. The pectoralis minor muscle is one of the most superficial muscle on the anterior aspect of the chest or the thoracic wall. The primary action of this muscle includes the stabilization, depression, abduction or protraction, internal rotation, and downward rotation of the scapula. The serratus anterior muscle is a fan-shaped muscle that originates on the superolateral surface of the first to eighth ribs. The function of this muscle is contraction of the entire serratus anterior leads to the anterolateral movement of the scapula. Then while the external intercostal muscle are located superficially to the internal intercostal muscle. The function of this muscle is being one of the accessory respiratory muscle. The external intercostal muscle is elevated ribs during forced inspiration. This muscle increases the transverse and anteroposterior diameter of the lungs. And now, we're proceeding to posterior thorax. The posterior category have four muscles too: the trapezius muscle, teres minor muscle, the teres major muscle, and the latissimus dorsi. The trapezius muscle is a broad, flat, superficial muscle extending from the cervical thoracic region. The function of this muscle is descending upper fiber act with a levator scapula muscle to produce an elevation of the scapula. The teres minor muscle is a narrow shoulder muscle that are extended from the lateral border of the scapula. The function of this muscle is rotating calf muscle that creates the functional muscular unit that both stabilize and produce movement of the shoulder joint. Then the teres major muscle. The teres major muscle is located a small muscle that runs along the lateral border of the scapula. This function muscle is the main of the teres major is produced to movement to the humerus in the glenohumeral joint, while the latissimus dorsi is a large flat muscle covering the width of the middle and the lower back. This muscle function is have three functions: the flex arm, the abduct of the internally rotates the arm, and the humerus fixed against the scapula. So what is a muscle of the abdomen? The abdominal muscles are a set of strong bands of a muscle lining the wall of your abdomen. So the abdomen muscle is a trunk of our body. The abdomen located towards the front of our body between your ribs and your pelvis. The abdominal muscles have several important jobs, help with essential bodily functions, including urinating, defecating, coughing, sneezing, and vomiting. Hold your internal organs in place and protect them, including your stomach, intestines, pancreas, liver, and gallbladder. Then the last is the maintain consistent internal pressure in the abdomen. So,
The two vertical muscles are the pyramidalis and the rectus abdominis. The pyramidalis is the vertical muscle is small and shaped like a triangle, while the rectus abdominis is the pair of the muscle goes down the middle of your abdomen from your ribs to the front of your pelvis. The pyramidalis is the muscle usually
contracts together with other abdominal muscles, contributing and contracting the abdominal wall, increasing the positive abdominal pressure, while the rectus abdominis is flexes trunks anteriorly, however working together with other abdominal muscles. The three flat muscles is the external obliques, the internal obliques, and the transversus abdominis. The external obliques is the part of the muscle, one each side of the rectus abdominis. The external is the pair of muscles on top of the external obliques, just inside your hip bones. And the transversus abdominis is the bottom of your stomach. The external obliques is the unilateral or bilateral when acting unilateral and the synergy with the contralateral external abdominal obliques. The internal obliques is the several functions that dependent upon which part of the muscles contracts, while the transversus abdominal functions along the other muscles of the abdominal wall, and transversus abdominis plays an important role in maintaining normal abdominal wall tension.
Muscle of the pelvic floor. The pelvic floor consists of muscles and connective tissues that support important organs in your pelvis, like your bladder, bowel, and internal reproductive organs. Along with other key muscle groups in your torso or core, your pelvic floor muscles allow your body to absorb outside pressure, protects your spine and your organs. Your pelvic floor muscles hold these organs in place while also providing the flexibility to assist with bodily function like peeing, pooping, and sex. Pelvic floor muscles hold the major organs in your pelvis in place and protect them. Muscle control, the ability to squeeze and relax your pelvic floor muscles, coordinate with organs like urethra and anus. A man's pelvic floor muscles support his bladder and bowel, and the urethra and the anus all pass through the pelvic floor muscles. It is a normally wrapped quite firmly around these passages to help them keep them shut. The reproductive parts affect how your pelvic floor muscles function. Pelvic floor muscles are operate differently depending on whether you are assigned female at birth or assigned male at birth. The pelvic floor consists of layer of muscle and connective tissues connecting those muscles. The two muscles intertwine to form pelvic floor muscles. The first one is a levator ani, composes bulk of pelvic muscles, wraps around the entirety of pelvis. The levator ani muscle is supporting and raising the pelvic visceral structures. It also helps in proper sexual functioning, defecation, urination, and allowing various structures to pass through it. The second main muscle is a coccygeus, the smaller muscle component in your pelvic floor muscles. Coccygeus contributes to the formation of pelvic floor. Therefore, it functions to support pelvic viscera but also functions to pull the coccyx forward after the defecation.
One of the most common body parts that we use in our everyday lives is our upper limb. And in order for our upper limb to function and move, we need to use the muscles of the upper arm and forearm. Now, what are the muscles of the upper arm and forearm, and what are their functions? When referring to the arm, it is the part that extends from the shoulder to the elbow. The muscles of the arm are responsible for flexion, extension, and pronation, supination. They are divided into anterior and posterior groups, but the chief action of both groups is at the elbow joints. The forearm extends from the elbow to the wrist, and it permits supination and pronation. It also assists the shoulder in application of force and in controlling the placement of hand in space. It also helps with fine motor movements, such as wiggling your fingers or fastening a button. Some muscles sit deep inside your arm, while some are superficial. One of the most common superficial muscles is the biceps, which is why it is commonly shown off as one of the muscles of the arm. Our arm has four major muscles, wherein three of them are flexors. The biceps brachii, the brachialis, and the coracobrachialis are in the anterior, and one of them is an extensor, which is the triceps brachii that is located in the posterior compartment. Here are more functions of the arm and forearm muscles. Muscles on both the underside and top of your forearm allow you to bend, flex, and extend your wrist and fingers. It allows you to move your hand toward your body and turn your hand away from your body. It also allows you to turn the palm of your hand to face down. Muscles located deep inside your forearm have several jobs. Two of them are controlling the top joints of your fingers and moving your thumb joint. The upper arm muscles help you move your arms. They have different jobs based on their location. One function is to bring your arm toward your body, called adduction, extending your forearm at your elbow, extension, flexing your arm at your elbow, called flexion, moving the top part of your arm at your shoulder, and raising your arm above your head. In this side, you can see the superficial and deep forearm muscles that are in charge of movements of forearm, hands, and fingers, such as the deep extensors that move the joints of the hands and fingers that you can see listed on the lower right hand of the list, one of which is the abductor pollicis longus that abducts the thumb. When it comes to the muscles of the palm, they have a variety of functions. One of its function is to move the digits, and by digits I mean our fingers, which are numbered from 1 to 5, beginning with the thumb as digit 1, digit 2 being the index finger, digit 3 being the middle finger, digit 4 the ring finger, and digit 5 the little finger. Another variation of the muscle of the palm's activities is free motion, power gripping or handling, precision handling, and pinching. Whenever we say power gripping or power handling, it means to grasp something cylindrical like a cup. Another version is the hook grip, which is the posture that we use when we carry a briefcase. When we say precision handling, it involves a change in the position of a handled object that requires precision control, such as holding a pen or a pencil. Pinching refers to the compression of something between the thumb and the index finger. One example is when we hold a coin by its edge. In this slide, you can see the different muscles that are used when it comes to pinching and for power gripping. Muscles involved in pinching are the adductor pollicis, the first dorsal interosus, the flexor pollicis brevis muscles. Muscles involved in power grip are the interossei, the metacarpophalangeal flexors, and the lumbricals.
So here in this part, I will be discussing the muscles of the gluteal. The gluteal muscles are important for a variety of activities, including walking, standing on one leg, and walking up the stairs. Gluteal muscles are the most superficial group of the posterior hip and thigh muscles. This muscle group consisting of the gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia latae muscles. Gluteus maximus is the largest and most superficial of the gluteal muscles. Glute meaning rump or buttock, maximus meaning largest. providing the majority of the shape to the buttock region. This muscle has a large site of origin. Its main function is to extend and abduct the thigh at the hip joint. Gluteus medius, medius meaning middle, is found deep to the gluteus maximus and superficial to the gluteus minimus. Function of its muscle is to abduct and internally rotate the thigh at the hip joint. This muscle also contributes to the stabilization of the pelvis and trunk during the gait cycle, a repetitive pattern involving steps and strides. The gluteus minimus is the smallest and deepest of the gluteal muscles. These muscles acts in synergy with the gluteus medius to abduct and internally rotate the thigh. Tensor fascia latae is a fusiform muscle located in the anterolateral aspect of the thigh, meaning situated in front and to the side. Its function is to abduct the thigh at the hip joint and to externally rotate the leg at the knee joint. Since the muscle crosses the hip and knee joints, it contributes to the stabilization of both. The thigh contains some of the largest muscles in the body. Thigh muscles allow the lower body to bend, flex, and rotate. They also bear most of the body's weight and keep the hips and legs aligned, in addition to providing and assisting with balance. Thigh muscles can be grouped based on their function and location. Each group of muscles in the thigh has a different functions. Adductors, medial compartment of the thigh, allow you to bring the thighs towards each other, which is called adduction. They help you stay balanced, keep the legs and hips in alignment, and allow rotation through the hips and legs. Adductors include 5 muscles: tuber gracilis, obturator externus, adductor brevis, adductor longus, and adductor magnus. They are on the side of the thigh, starting at the pelvis and extending to the femur. Next one will be the hamstrings, which allow you to extend your hip to move your leg behind your body, such as when you walk and put one leg behind you. They also let you flex your knee, like when you squat. Hamstrings consist of 3 muscles: semitendinosus, semimembranosus, and biceps femoris. They run down at the back of the thigh from the hip to just below the knee. Pectineus enables you to flex and rotate the thigh at the hip joint, which also helps to stabilize the pelvis. Pectineus is a plot muscle that extends from the front of the pelvis to the top of the femur. Next one will be the quadriceps. Allow you to flex your hip, for example, squatting or sitting, or extend the knee, standing or reaching the legs straight in front of you to take a step. Quadriceps include 4 large muscles located in the front of the thigh: vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. They start at the pelvis, femur, and extend down to the patella and tibia. Last one will be the sartorius, which helps you flex and rotate the thigh from the hip joint. You use it when you cross your legs to rest one ankle on the opposite leg. Other examples include sitting cross-legged on the floor or bending and rotating your leg to look at the bottom of your feet. Sartorius muscle is a long, thin muscle, the longest in the human body. It starts by the hip and wraps across the front of the thigh, then downward toward the knee.
Muscles of the legs. Leg muscles help you move, carry the weight of your body, and support you when you stand. And it is the largest and strongest muscle in the body. They work together to enable you to walk, run, jump, and flex, and point your feet. What is the purpose of the leg muscles? Your lower leg muscles have many important jobs. They include anterior muscles, lateral muscles, and posterior muscles. Anterior muscles. These muscles help you lift and lower your foot and extend your toes. They are in the front or anterior part of the leg. Lateral muscles running along the outside of your lower leg. These muscles stabilize your foot when you're walking or running. They also allow you to move your foot from side to side. Posterior muscles. These muscles are in the back of your lower leg. Some are superficial or close to the surface of your skin, and some sit deeper inside your leg. They help you flex and point your toes, jump, run, and push up into a sprint. Lock and unlock your knee. Maintain good posture by stabilizing your legs and standing up straight by supporting the arc of your foot. Intrinsic muscles of the foot. Intrinsic muscles of the foot originate and insert within it. The foot are limited to support and locomotion. These are the two main actions: to stabilize the foot and support the arcs, to maintain foot structure, and to aid the actions of the muscles of the lower leg to produce fine movements of the toes. The foot can be divided into two main parts: the sole or plantar region, which is the part of the foot contacting the ground, and the dorsum of the foot or the dorsal region, which is the part directed superior. What are the dorsal muscles of the foot? The dorsal group consists of two muscles, extensor digitorum brevis and extensor hallucis brevis. Both muscles act to extend the toes. They originate on the superolateral surface of the calcaneus and pass underneath the tendons of extensor digitorum longus as they pass over the dorsal aspect of the foot. Central plantar have four layers. First layer, abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. The second layer is quadratus, plantae, and lubricals. The third layer, flexor hallucis brevis, adductor hallucis, and flexor digiti minimi brevis. And the last layer, or the fourth layer, are plantar and dorsal interossei.